I'm working at being the strongest I'm able to be and to surpass my goals of being a healthy grandma.
Women are under-researched, under-aware, under-diagnosed, under-treated, and under-supported, according to Heart and Stroke. There was a study done in 2018 called Misunderstood that found that 78% of women who presented with heart attack symptoms were missed because we present differently. Her Heart, Her Way is a heart health prevention program for women who have not been diagnosed with heart disease yet, but are at risk.
Having strong leadership at the community area level was paramount in getting us into the primary care clinics so that they could go through their patient loads and identify women who would be eligible for our initiative. We are expanding the offerings of Her Heart, Her Way and how mentors are connecting. We are doing virtual as well as local types of resources. Our mentors are really skilled, and it's helping our participants stay on track.
We focus on assisting our participants in our three main pillars: exercise, stress management, and nutrition.
I've really enjoyed having a coach. She gives me positive feedback and good ideas on how to do even more.
There's several different metrics that we're using to be able to look at how effective the program is. We're looking at changes in blood pressure as one of the primary outcomes, and then also changes in how much physical activity women are reporting they're doing. As women are doing the program for 6 and 12 months, they're telling us that they're adding up to more than 30 minutes of exercise to their lives. So that would influence a lot of different changes, general health, mental health, as well as weight, cardiovascular disease, blood pressure. And it's those changes in behavior that really lead to improved outcomes for these women.
I have achieved the desire to get moving continuously and not sit for long periods of time watching TV or reaching to the snack bowl. I was just measured and my circumference around the waist went down.
One of the things we do as mentors is provide resources of physical activity in your community.
I think that a project like this has the potential to really change the health of our community. I think it allows people to engage in primary prevention and self-care and early intervention where they live, which is in community. But I also think as a hospital foundation, the more that we can impact community-based health, the more we can change our outcomes for our hospitals.
If anybody's ever tried to change healthcare, it's monumental, it's challenging. Now there's a referral system for women from access centers and different clinics in the community to be referred to the Reh-Fit Center, to the Her Heart, Her Way program.
The Her Heart, Her Way program has provided access for Garry and the My Health Team clinics an opportunity to connect women with alternative options for addressing healthcare needs. We were a good partner for this project because we have a long-term history in dealing with cardiac issues and prevention. Our hope is that women will be proactive in taking care of their health.
It's changing the way healthcare providers think about cardiovascular disease risk. They know cardiovascular disease risk is bad, they want to do things about it, and referring patients to the Her Heart, Her Way program gives them an easier mechanism to be able to refer their patients, and then they follow up because they look for information in the electronic medical record.
The early support of donors inspired this project completely, and it allowed us to have a place in order to build from the research, the primary prevention studying, the understanding what we needed to do. We were able to build this program in a fulsome way.
We are just thrilled that we're getting such a variety of participants at this point.
1 year later, women are still improving on average by 3 millimeters of mercury of blood pressure. So that'd be equivalent to reducing the risk of cardiovascular disease by roughly 10%.
I have spoken to several ladies about the Her Heart, Her Way program because it's free. And, you know, there's no catch to it. It's just beneficial. I really think that my goal is to continue being the healthiest person I know how to be.